Hypopituitarism is characterized by the undersecretion of pituitary hormones and can be attributed to various causes, including not-secreting pituitary adenoma, craniopharyngioma, Sheehan syndrome, empty sella syndrome, pituitary apoplexy, brain injury, and radiation exposure. The recommended treatment for hypopituitarism involves hormone replacement therapy, which includes the administration of glucocorticoids, thyroxine, sex steroids, and human growth hormone. A not-secreting pituitary adenoma, also known as a non-functioning pituitary adenoma, is a type of tumor that arises in the pituitary gland but does not produce excessive amounts of hormones. Unlike functioning adenomas that lead to hormonal overproduction, non-secreting adenomas do not secrete hormones themselves. However, they can cause hypopituitarism through mechanical compression and disruption of normal pituitary function. Here's how non-secreting pituitary adenomas can contribute to hypopituitarism. 1. Mechanical compression. As the non-secreting adenoma grows, it can exert pressure on surrounding pituitary tissue. This compression can interfere with the normal functioning of the pituitary gland, disrupting the release of hormones. The compression may affect both the anterior and posterior portions of the pituitary gland. 2. Disruption of hormone production. Even though the tumor itself does not produce hormones, its presence can disrupt the synthesis and release of hormones by the adjacent pituitary cells. This disruption may lead to decreased production and secretion of pituitary hormones. 3. Effects on hypothalamus-pituitary axis. The pituitary gland is a crucial component of the hypothalamus-pituitary axis, which regulates the release of various hormones in the body. The presence of a non-secreting adenoma can disturb the intricate balance of this axis, resulting in inadequate production of hormones that are essential for normal bodily functions. 4. Impaired feedback mechanisms. The pituitary gland relies on feedback mechanisms to regulate hormone levels. Non-secreting adenomas may interfere with these feedback loops, leading to dysregulation of hormone release. This dysregulation can result in hypopituitarism, where there is a deficiency of one or more pituitary hormones. Hypopituitarism caused by non-secreting pituitary adenomas often manifests with symptoms related to the deficiency of specific hormones. Common symptoms may include fatigue, weakness, weight loss, menstrual irregularities, infertility, and intolerance to stress or cold. Treatment options may include surgical removal of the adenoma and hormone replacement therapy to address the hormonal deficiencies. Another cause of hypopituitarism is craniopharyngioma. Craniopharyngioma is a rare type of benign, non-cancerous brain tumor that primarily occurs near the pituitary gland at the base of the brain. This tumor develops from remnants of embryonic tissue that are left over from the formation of the pituitary gland. Craniopharyngiomas are most commonly found in children and adolescents but can also occur in adults. Craniopharyngiomas can cause hypopituitarism through several mechanisms. 1. Compression of the pituitary gland. Craniopharyngiomas are typically located near or within the sella turcica, where the pituitary gland is situated. The tumor's growth can lead to compression of the pituitary gland, affecting its ability to produce and release hormones. 2. Disruption of the hypothalamus-pituitary axis. The hypothalamus and pituitary gland work in tandem to regulate various hormonal functions in the body. Craniopharyngiomas may interfere with the normal functioning of the hypothalamus-pituitary axis, disrupting the release of hormones that control other endocrine glands. 3. Direct damage to pituitary tissue. As the tumor grows, it can directly damage the pituitary tissue, impairing its capacity to produce hormones. This damage can lead to deficiencies in hormones produced by the anterior pituitary, such as growth hormone, thyroid-stimulating hormone, and gonadotropins. 4. Surgical intervention. The treatment for craniopharyngioma often involves surgical removal of the tumor. However, the surgical procedure may inadvertently damage the surrounding pituitary tissue, contributing to hypopituitarism. Hypopituitarism resulting from craniopharyngioma can lead to a deficiency in various hormones, causing symptoms such as growth failure in children, fatigue, weight gain, cold intolerance, menstrual irregularities, and other manifestations of hormonal imbalance. Management of hypopituitarism in these cases typically involves hormone replacement therapy to address the specific hormone deficiencies. Another cause of hypopituitarism is Sheehan syndrome. Sheehan syndrome, resulting from ischemic infarct of the pituitary following severe postpartum hemorrhage, is marked by pregnancy-induced pituitary growth, leading to increased susceptibility to hypoperfusion. This condition typically presents with failure to lactate, amenorrhea, and cold intolerance, with a predominant impact on anterior pituitary hormones. Another cause of hypopituitarism is empty sella syndrome. Empty sella syndrome, characterized by atrophy or compression of the pituitary within the sella turcica, is often idiopathic and more prevalent in obese females. It is frequently associated with idiopathic intracranial hypertension. Another cause of hypopituitarism is pituitary apoplexy. Pituitary apoplexy, marked by a sudden hemorrhage of the pituitary gland, commonly occurs in the presence of an existing pituitary adenoma. Its clinical presentation includes a sudden onset of severe headache, visual impairment, such as bitemporal hemianopia and diplopia due to CN3 palsy, and features of hypopituitarism. Other potential causes of hypopituitarism encompass brain injury and radiation exposure. The recommended treatment for hypopituitarism involves hormone replacement therapy, which includes the administration of glucocorticoids, thyroxine, sex steroids, and human growth hormone.